The number of coronavirus cases in Pakistan has passed 100,000. Infections jumped after the Islamic holy month of Ramadan ended and markets reopened. Doctors and other health professionals wanted tougher lockdown measures, including the closure of mosques, but the government rejected that. More than 2,000 people have died from COVID-19 in Pakistan. Let's go to our correspondent Kamal Hyder, who is live for us in Islamabad. Kamal, what are the projections here about the peak of the outbreak? Are things expected to get worse before they get better?
Absolutely. It's important to note that Pakistan, the number of confirmed cases in this country have now surpassed that of China. And that, of course, is raising concern here because the World Health Organization had earlier warned that that figure could go to 200,000 or possibly even above that by July. So indeed, this is a warning sign. And as you mentioned, the government also in a very difficult position because on the one hand, it's the survival of millions of people who depend on daily wages by doing daily jobs. And the unemployment figures, of course, rising, that Pakistan cannot afford such a calamity. Also, important to note that two of the hardest hit provinces are the province of Sindh with over 38,000 confirmed cases and the Punjab. Both are densely populated. They also contribute a significant amount to the economy. And the government estimates, these are initial estimates, that the country has already suffered 2.5 trillion rupee loss because of COVID-19. Also not to forget that large swarms of locusts are also sweeping through the bread baskets, and that, of course, could threaten Pakistan's food security. So the government in a real fix, because on the one hand, if they do go into a lockdown, there will be millions and millions of people, almost 65 million laborers work in Pakistan. They will be unemployed, and they would, of course, be then the consequences and ramifications of that. So indeed, a difficult position, but a dangerous time. And the medical experts warning that the next 2 weeks will be critical.
Kamal, so no lockdown, but are there any sort of mitigation measures in place? And how is the health system coping with all of this?
Well, Pakistan's health system is already overburdened. It was not at par with the first world. This is a developing country. And then when you have such a large number of infections with this pandemic, it has put a severe strain. And according to experts, it is not sustainable with the rising number of confirmed infections. Also not forgetting that Pakistan is trying to achieve to get up to 30,000 tests a day. It's a country of over 200 million people. So the true scale of the pandemic has not yet been felt. But people are now beginning to realize that this is a potential crisis that could threaten Pakistan's future political and economic stability.
Thank you for that. That's our correspondent there, Kamal Hyder, live from Islamabad.